All right, so we're going to try something new. Just go over the lab slides so you can watch us later on. But just going through the slides one by one. This is lab 3 on the back, looking at the muscles and the attachments. So first slide, review the attachments, innervation, and actions of the trapezius and latimus dorsi muscles. All right, so down here is the lat dorsi, and it is innervated by the thoraco dorsal artery, which we can remember from the brachial plexus. It's from C6 through C8. Then up here we have the trapezius, and the trapezius is innervated by the nerve from the brain, so that's cranial nerve 11. All right, and then moving on, the rhomboid major, minor, and levator scapulae. Okay, and so we have here, right here, is the rhomboid minor, and right below it is the rhomboid major. Then we have up here the levator scapulae, and both these are innervated by the first branch from our brachial plexus off of C5, the dorsal scapular nerve. All right, moving on. Then we have our muscles at the back, and so from outwards to inwards of the erector muscles, right, these are the erector muscles right here, we have the spinalis, which is the closest to the spine, that's why it's nicely named spinalis. Then we have the longissimus, which we can see here and trace it all the way along the spine. Okay, longissimus. All right, and on the very outside we have the iliocostalis muscle. All right, and all three of these are innervated by the posterior rami of the spinal nerves. And then finally we have the semi-spinatus right here, capitis, semi-spinalis capitis. Okay, and then we have the splinus capitis, lateral to that. All right, and same thing, posterior rami of the spinal nerves. All right, the bones of the vertebral column, we start with the cervical vertebrae, and we know that there are 7 of them, CV1 through CV7. Then we have the thoracic, in other words, the ones that are connected to our ribs, and so those are TV1 through TV12 for 12 ribs. Below that we have the lumbar, and there's 5 of those, oops, L1 through L5. Then we have our sacrum, so sacral, and there's 5 of those as well. We can see that they're fused together, so SV1 through SV5. And then finally we have our coccyx, and there's 4 of those, C1 through 4. Don't think those are given a letter. All right, what are the general features of the vertebra? So we have the vertebral foramen, which is this hole in the center that the spinal cord goes through. We have the pedicles. We have the transverse processes, these parts that come out like that. We have the lamina. And then we have the spinous process, which protects the spinal cord posteriorly. All right, so over here we have a notch right I think, actually this is referring to this guy right here. This is the superior vertebral notch. And you can see when 2 of these are on top of each other, we get the inferior notch here, and then the superior notch of the vertebrae below it will make the intervertebral foramen being whole. Up here we have the superior articular process, where you have 2 vertebrae come in contact with each other, and you'll have a synovial joint there. All right, here's the inferior articular process and inferior vertebral notch. All right, so not too bad. Then we have, how do the 2 vertebrae fit together? Well, we talked about that synovial joint, and that's the zygapophyseal joint. And you can see, as we said, we have the superior and inferior notches formed when the pedicles are near each other. That makes the intervertebral foramen. All right, then we have the intervertebral disc, and there's 2 parts to that. There's kind of this fibrous outside called the annulus fibrosus. Annulus fibrosus, you remember that, like kind of like a tree, with the rings of the tree every year, annually, it has a new ring. But so we have annulus fibrosus, circular fibers, and on the inside we have the gel-like squishy material, which is the nucleus pulpus. And then we also remember that when you talk about slip discs, the discs don't actually fall out in between the vertebrae, but they will bulge out or herniate and then pinch these nerves that are posterior to the spinal cord. But the disc itself doesn't completely slip out. There's herniation, and this gel substance right here will kind of bulge outwards, and then it will press on the nerve and cause a lot of pain. It's not enjoyable. All right, so if you look at the top of the vertebrae, we have the cervical vertebrae. Remember, CV1 through CV7. If you were to press the back of your neck and go from your head and follow the back of your neck down until you reach the first bump, before you reach that first bump, you're pressing on the nuchal ligament. And that first bump you feel is the vertebra promens, which is the spinous process of CV7. So CV7, the last cervical vertebrae. And then, what muscles attach to this guy? Well, we know a whole bunch, right? We have the trapezius, we have the rhomboid minor, we have the serratus posterior superior, and then we have the splenius capitis. Okay, so quite a few. If we look at CV3 through CV7, we have the transverse foramen. This is the big thing that makes the cervical foramen different. We have our arteries that go through there. Other than that, it's relatively the same. You can see that the vertebral body, which is oval-shaped, has a concave on the top as they fit together, and it's convex on the bottom. So concave on top, convex on the bottom. All right, if you look at the very first vertebrae, CV1, that's called atlas. It has a faucet for the dens, and this dens is this guy right here on CV2, which allows us to shake our head back and forth. No right? And so up here, I would say this is responsible for us being able to go nod our head saying yes. And the dens is held in place, one, by this faucet, but then two, we have the transverse ligament of the atlas. All right, and then here you can see, even though they're quite small, we do have a transverse foramen on both CV1 and CV2. All right, the thoracic vertebrae, remember these articulate with the ribs, and so we have 12 of them, just like we have our 12 ribs. And on those, we have these faucets right here with 3 different names. The one that is most anterior is the costal faucet. Then we have the costal demifaucet. And then finally, we have the transverse costal faucet. All right, and so for the costal faucet, we have the head of the rib articulates with it. And then for the transverse faucet, we have the tubercle of the rib articulates with it. And then the demicostal is part of the head of the next rib down. Okay, so then we go down to our lumbar vertebrae. Here we have our body is kidney-shaped. Other than that, you can see that there is no transverse foramen. And then we don't have any costal faucets, so it's pretty bare bones. But they can articulate with each other in our articulation surfaces on top and bottom. So it's still got that joint between the vertebrae. All right, then our sacrum and coccyx. If we take a look at those, we have on the very top of the sacrum is the promontory. Then we have the sacral canal, and we have the sacral hiatus at the bottom. We have articular faucets. We do have foramen for nerves. And then finally, what is located in the sacral canal? Well, we have the filum terminae, which anchors the spinal cord to the end of the coccyx. So remember that the spinal cord doesn't go all the way down to the end of the coccyx. In fact, it stops quite earlier at the level of LV2. So LV2 is when our spinal cord ends inferiorly, and then after it ends, it has the cauda equina, which has basically just nerves extending downwards. And then you have the lumbar cistern, and you can see here, LV2 to SV2. And so you still have spinal fluid in this area, but you have, right, so going down here, so LV2 all the way to SV2, you still have the dural sac, and it's filled with spinal fluid. And so the lumbar cistern, this area from the end of the spinal cord to the end of the dural sac, is still full of spinal fluid. So between LV2 to SV2 is an opportunity to take samples of cerebral spinal fluid. And so, you typically do that closer to the inferior end, but it's an opportunity to perform a spinal tap. All right, so why are there 8 cervical nerves but only 7 cervical vertebrae? Well, it just has to do with the transition. So from C1 to C7, all of these nerves are superior to the vertebrae, right? So you can see this is CV7, and the nerve right here is right there. And then after that, we transition. So we have CV8 is inferior, and after that, you have TV1 is inferior. The T1 nerve is inferior to TV1. Okay, but C8 is our transition from C7 is our last superior nerve to its vertebrae, and then after that, everything is inferior to the vertebrae. It shares the same name. All right, so the spinal cord, label all the sections. So we have the posterior root, which is taking in sensory data. We have the anterior root, which is sending out motor data. And so in our posterior root, which has the sensory data, the cell bodies are located outside of the spinal cord itself, in the spinal ganglion. In our anterior root, which has the motor signals going out, the cell bodies are actually located in this gray matter in the spinal cord. Okay, and so so we have our sensory side posteriorly, and then we have our anterior side, the motor signals going out. And so if you look at a spinal nerve overall, it would be a mix of the two bundled together. And then you have branches of spinal cord. You have posterior ramus, which is mixed, and posterior ramus is going to have the both sensory and motor nerves. And posterior ramus is for the skin and back muscles, skin of the back and the back muscles. And then the anterior ramus is going to also be mixed with sensory and motor neurons, and it's going to innervate the skin and the limbs, as well as muscles in the front of the body. So the deltoid muscle, we have the axillary nerve. This is pretty straightforward. The clavicle, the spine, the scapula are the insertions, or the origins, and then the insertion is the deltoid tuberosity of the humerus. And then we have different muscles that we care about here. The infraspinatus, which we have the suprascapular nerve. The teres major, which is the inferior subscapularis nerve. Notice suprascapular nerve, which does infraspinatus and supraspinatus. And then the subscapularis nerve, there's the inferior, which does teres major, and the subscapularis muscle, which you don't see on the side, but it's on the other side of the scapula. The subscapularis muscle is innervated by both the inferior and superior subscapularis nerve. Teres major is just the inferior one. Then you have teres minor, which is innervated by the axillary nerve, which we know also innervates the deltoid. Okay, all of these nerves are from branches of the brachial plexus. All right, then down here we have the lateral head of the triceps brachii. We of course know when we're dealing with the arm, posterior forearm and posterior arm are all innervated by the radial nerve. We love the radial nerve. All right, moving on. Now we're talking about these spaces, and so this is the prone position, as if the person's face is, on the table, facing downwards. And so we have the different spaces which can allow us to locate some important components. And so one way to look at this from the prone position is to use your fingers, and you take the fingers of your right hand, your pointer and your middle finger, and then the pointer and middle finger of your left hand, and you put the middle finger of your right hand on top of the two fingers from your left hand, and your index finger below the two fingers from your left hand. And so you make this shape that looks kind of like this. And so you can see it makes three different compartments. Your left hand, your anyways, your fingers should represent teres minor, and this one right here is teres major. Then we have right here is the lateral head of triceps, and then this is the humerus. And this gives rise to three regions. We have the quadrangular space right here, and that will house the auxiliary nerve, which we know innervates teres minor and the deltoid, and the posterior humeral circumflex artery. Then we have the triangular interval right here, which also has two things: the radial nerve, which we know is important for innervating all of the muscles on the posterior compartments of the arm and forearm, so very important, don't damage that, and the profunda brachii artery, which innervates the muscles of the posterior arm. Okay, then we have over here the triangular space, which is right here in our diagram, and that one's pretty easy. It's only the circumflex subscapular artery, which is going to innervate our subscapularis muscle, or deliver blood to the subscapularis muscle. So if we flip over, you have the same situation. It's a little bit harder to view in the sense that you have your long head of the triceps, you have your humerus, you still have your your teres majors here, and then your teres minor is going to be up here, and so you still have your three spaces, but it's a little bit harder to view, but you can find it. All right, so suprascapular artery and nerve. This is coming up to the supraspinatus and then the infraspinatus, and you specifically have this when you're dealing with this nerve. You have this ligament right here connecting the basically it's a notch along the superior angle of the scapula, and so there's this little notch right here, and that notch has the superior transverse scapular ligament. And so if you can find that ligament, the saying is army goes over, navy goes under, and so the artery goes over the ligament, and the nerve goes under the ligament. So this is our ligament, the army goes over, so our artery, and our nerve, navy, goes under. Okay, but this is for the scapular notch, the top of the scapula. All right, and then this is what happens if we're blocked on the second part of the auxiliary artery. Well, you can use the subscapular artery, and we know that can come around here, and you can get back to the auxiliary nerve. So subscapular artery, or suprascapular artery, will eventually connect to the subscapular artery, which connects back to the auxiliary artery. So there's multiple ways to get back to the auxiliary artery. All right, this one is hard. I honestly don't know how to remember this well, but I think that, here we're looking at the posterior part of the arm, and remember that the radial nerve and the auxiliary is teres minor and the deltoid, whereas, radial is everything in the posterior arm and forearm. So I think we remember these, that, branches of the auxiliary nerve and the radial nerve will innervate the skin. And so that's how we can get, further down. We have the posterior cutaneous nerve of the forearm. We have the inferior lateral cutaneous nerve of the arm, radial, the posterior cutaneous nerve of the arm from the radial. And then up here, you see that we're, along the deltoid, right? And so the deltoid, again, is from the auxiliary nerve. So we have the superior lateral cutaneous nerve of the arm from the auxiliary nerve. And then we have the medial cutaneous nerve of the arm. Yeah, good luck remembering that, but we'll try our best. And then we have the intercostobrachial nerve as well. All right, I think that's just about it. Three heads of the tricep brachii. We have our long head, we have the lateral head, and then deep to both of those, we have the medial head of the triceps muscle. All right, so that's it, and good luck to us.